Hey everybody! So in this video, we are going to be talking about living with DID or OSDD and practicing self-care. Now, self-care is very difficult for a lot of people who've been through traumatic experiences because the trauma, whatever it may be, affects your sense of self. It affects the way you think about yourself. It affects the way that you relate to yourself. And for a lot of people, they carry around a lot of shame, a lot of feelings of being not good enough, and this can mean that they neglect their own self-care. That is something that many of us have struggled with many times, and still sometimes do struggle with even now. And practicing self-care is incredibly, incredibly important because it has a huge impact on your mental health. Now, what is self-care? Self-care is doing things for your own well-being, mentally and physically, to take care of yourself psychologically. It's not just feeding yourself and taking a shower. These are typical activities of daily living, but it's not the same thing as self-care. An example of self-care would be taking the time to read a nice book and relax for a little while, taking a few minutes to yourself to meditate, taking a nice warm bath just for the sake of relaxing. Self-care is all about maintaining your psychological well-being and your mental health. So, some tips on how to practice self-care if you're living with DID or OSDD, or even if you're not and you just need some help learning. First thing, identify the things that help you feel good about you, that help you feel calm, relaxed, and safe. Making sure, of course, that these are healthy behaviors. If it harms your body, if it harms you mentally, if it leads to feelings of shame, then that is not a self-care activity. So identify those healthy behaviors and healthy activities that help you to feel good about you and that help you to feel safe, and then take the time to do them. And I know that's really hard for a lot of people to make time for their own needs, especially when you're talking DID and OSDD systems, when you have multiple people that have different needs, but it's important. And it doesn't have to be extremely long periods of time, even just 5 minutes here or there. So in the case of DID or OSDD, you have an individual system member who's out and they're feeling a little stressed. So they go make themselves their favorite drink, like a nice cup of tea. They sit down, they drink their tea, they read a book. That would be self-care. Another example of self-care that a lot of people struggle to remember is when something is triggering to mental health struggles, PTSD, or otherwise, it's okay to walk away. It's okay to stop engaging in a conversation that is creating distress or is re-traumatizing, and come back to that discussion if it needs to happen at all at a later time. And if it's not a necessary discussion, if it's just someone wants to argue with you or be in your face, it's okay to just walk away and not talk to that person. It's okay to say no. And saying no is a big part of self-care. Not taking on more than you can handle. Being realistic about your limitations and your boundaries, and then keeping those boundaries and not letting people violate them and then not doing anything about it. Because, let's be honest, people are going to make mistakes. They're going to mess up. But if you don't tell them that they're violating a boundary, they won't know. So speaking up and setting your boundaries clearly and then holding those people accountable, that is part of self-care also. It's very, very important to make sure that you take care of you, whether that's you as a single individual or you as a group system who all needs their own self-care. It's important to make sure that you are maintaining your own well-being, the well-being of your system, the well-being of your life. And another thing about self-care that a lot of people often don't realize is that self-care doesn't have to look a particular way. As long as it is healthy and does not harm yourself, your mind, your body, or your system, for those of you out there who need help with self-care who have DID and OSDD, as long as it is not harming you in some way, that's okay. It's okay to just go sit in a room and be quiet for a while. It's okay to just take a break and just do nothing. There's nothing wrong with that. It's okay to just rest and take it easy. And it's okay for that to be the way that you practice self-care. If that's what you need, and it's not harming you or impacting your life negatively to do so, then just go sit and do nothing for a while. It's okay. So, I hope you guys enjoyed this video, and I hope you guys got a lot out of it, because self-care is really such an important topic, and it's one that is not really well understood by everybody. So, if you did like this video, please like, subscribe, and don't forget to hit that notification bell. Have a good day, everybody.